It says we're going to be live in 27 seconds, but I'm going to just say that we're live now. So, I don't know why it's doing that. That countdown is 36 seconds. So, anyway, we're going to start. I'm going to end that countdown to see if we could start it. Hello, everyone, and welcome to our stream today. I have Nikole Jones with us, our suicide prevention coordinator, and she's going to talk a little bit about the walk, and she's going to also talk about the event coming up on September 29th. Welcome, Nikole, and welcome everyone who's watching.
Thank you, and welcome everyone. I'm glad to be with you this afternoon, to talk about our Suicide Prevention Month activities. We've had a wonderful month of activities to bring awareness. For those that didn't come out, we had our third annual Suicide Prevention Awareness Walk at our Perry Point site. It was a great turnout. We had about 550 people show up to our campus to sign up, walk, and participate in our health fair. So it was just an amazing time. We had a veteran artist who designed our t-shirt this year, and it was a beautiful design t-shirt. And it's just a great time. And we talked about the risk factors, the warning signs, protective factors for suicide, so that our veterans and their family members would know exactly what they could do in case of crisis. And so I'm very excited and grateful for the turnout. If you didn't come this year, please come out next year. We're going to be doing it again for our fourth annual walk.
So tell us a little bit, do people have to, like some walks, people have to pay to register? Tell us about the logistics of joining the walk.
So the walk is absolutely free. We do want you to register so we can get a good count of how many people do come out. We do host a health fair simultaneously with our awareness walk. So there were this year over 30 VA and community programs that showed up. We had Chesapeake therapeutic riding program there, and they bought 2 of their miniature horses, Penny and Buttons. So we got to meet them. We had just a fantastic time. A lot of different programs came out to just tell a little bit about themselves and really to let the veterans know their resource in the community.
So was this year's walk attended by more than last year's walk? Is it growing every year?
It is indeed growing each year. We had almost 100 more people this year than we did last year. And what I love also, it was more than half of them were veterans, and some brought their family members. We had our employees come out to really show their support for suicide prevention and for our veterans. So it was just an amazing time. We even had the Kona Ice truck come out, and so people could get a snowball while after they walked. And so it was just really good time, and an important time for us to get to meet the community, as well as share the resources about suicide, and also decrease stigma, to say that suicide risk can happen to anyone. And we just want folks to know, please reach out to support. There are supports available that can help you in a crisis. You don't have to go through this alone.
So the takeaway from the walk is that there's a lot of people wanting to support suicide prevention in the community and at the VA. And if you're a veteran out there listening, if you are in crisis, or if a family member has a beloved veteran in crisis, there are definitely steps you could take. So that's a good segue into what's happening next.
Yes.
So what's happening next? I have a little flyer here.
Excellent. So yes, we want to make sure to reach out to those veteran loved ones, families and friends of veterans that may be at risk, or may be struggling, or may be connected to mental health, and you just want to know what you can do to support them. We are hosting a Friends and Family VA S.A.V.E training. And so the S.A.V.E training is a gatekeeper training for veterans to talk about the risk for suicide. the warning signs for suicide, as well as the resources available in a crisis. So we are offering this free training, absolutely free, for anyone. Veterans themselves can come if you're worried about a veteran buddy, if you're worried about yourself. We want you to come out. It's going to be on, I believe it's Tuesday, the 29th. I wasn't sure the day of the week. I know it's September 29th, and it's from 11 a.m. to 12:30 at the Baltimore VA auditorium. So you come right in and go to the second floor auditorium. And that's on North Green Street, Baltimore, Maryland. And it's going to be hosted by our suicide prevention team. Myself, I'll be the presenter, as well as our peer support, Jonathan Hollins, who some of you have met before, will be there to also present with me and be there as a liaison for our veterans. We're going to have a table of information, brochures, and some swag, some things that have these suicide prevention, the Veterans Crisis Line number on it, which is easy to remember. It's 988, and then you press 1 to identify yourself as wanting to have a veteran, to go to the Veterans Crisis Line. And we just want people to know the resource is available and what they can do to prevent their loved one from being in a crisis, but also what to do when a crisis hits.
So I know SAVE is an acronym because of those periods between the S-A-V-E. Can you talk a little bit about what that acronym means?
Yes. It's recognizing the signs of suicidal thinking, asking the question, validating that veteran's experience and their thoughts, where they are in that moment. And then the E is escorting and encouraging them to get help. And so it really is, all of the steps you need to really engage someone who's in a crisis, to help them get to safety, basically to supports. And the ask the question, people always say, well, if I ask that question, am I planting the idea of suicide in someone's head? No, you're not. Basically, the question is, are you thinking about suicide? Is suicide something you thought of? I've heard from many veterans that it's a sense of relief when someone does ask that question, and it doesn't plant it in their head. Most people are silently thinking about it before mentioning it to anyone. And so when you ask that question, you're giving them permission to talk about it. You're letting them know, I am okay with this conversation, and that you care. And so don't be afraid to ask the question. That's the most important thing we want to get across. If you feel like, someone may be struggling and thinking about suicide, ask the question, because you'd be amazed. That gives them permission to talk about it. And ultimately talking about it leads to getting support.
And can family members and friends who, can they come to this? And also, what about people who have lost already someone? Are they welcome to come as well?
Anyone is welcome. If there's a veteran in your life, if you've lost a veteran and you just want to get more information to help anyone else, certainly come. We talk about postvention a lot. For those that lost someone to suicide, it increases the risk, unfortunately, for there to be a suicide, like maybe in that family, because they've been exposed. And so to get the information is so important, so that you can know what to look for someone else. Maybe educate your people in your family, start doing trainings yourself or helping veterans. It's just being armed with the information. I always say, knowing the facts saves a life. And so, yes, come out. Anyone is welcomed. We're going to be out in the lobby, kind of letting people know, giving out flyers so that folks will know. Come back on Tuesday, the 29th, so that we can actually talk about suicide risk. Let me make sure it's Tuesday. Is that Tuesday? No, it's actually a Monday, the 29th. Come on out. We want to make sure that you're not alone. You're not going through this alone, that we are here to support you and walk you through it and give you as much information as you need to help your loved one.
So do people need to register?
You can register so that we get an idea of how many people. You can call the number that's listed. It is 410-642-2411. And actually, the extension is 6007, but you do have to dial a 2 before it. So it's 26007 to register. Or you can email myself, which is Nikole, Nikole.Jones@va.gov, and just say you'd like to be in attendance.
All right, I'm going to put that in our. Is there anything else that you want people to know about this current, about this upcoming event, about attending, coming, parking? Is there anything that they need to know, especially people coming from like Perry Point or Loch Raven? Is there anything they need to know?
Yeah, I don't know. Maybe you can we can certainly, if people want to travel on, we don't have an appointment necessarily, but if you do want to travel on the shuttle, you can call our office and we can try to make sure to arrange that. But yes, we just want you to come out 11 o'clock on Monday, the 29th to 12:30 p.m. And again, you don't, even if you forgot to register, we just want you to come show up. We want to get an idea of how many people are there. So it is great if you can email or call to let us know that you're interested in coming. But the reality is we will be there and we open the door to anyone who shows up. We just want you to get the information.
All right. Well, I think that's all we need right now. Thank you for people who are watching and liking. We see you. If you have any questions or comments, now is the time to put them in the comment section. We can actually see from wherever you're watching. If you have a question, we'll be happy to answer them now or even post an answer later. So thank you, Nikole, for letting us know about this very important event, September 29th, a Monday. At 12:30, 11 a.m. to 12:30 at the Baltimore VA Medical Center Auditorium. Bring your friends, bring your veterans that you love who may be in crisis. Bring yourself if you're a veteran and you might be struggling. So come on down and see what S.A.V.E. training is all about and meet others who may have similar stories. Anything else, Nikole?
No, I just want to thank everyone for this. This has been a wonderful Suicide Prevention Month, getting the word out. We are so happy for the level of participation that we had. And we just, again, want to state that knowing the facts can save a life. So please just come out and meet us there. We'll have information. We'll have swag on the table so that you can take some things home, magnets for your refrigerator, other items to keep reminding you that 988 is available, and we're here to help.
All right. Thank you, Nikole. And that's it for today's stream. Thank you for joining us, all who are watching or who will watch later. And we'll see you on the next stream. Bye-bye.